If you've been dealing with intense itching that gets worse at night, you might have scabies. Don't panic, it's more common than you think, and it's completely treatable. Stay with me because in the next 4 minutes I'm going to explain exactly what scabies is, how you get it, and how to get rid of it fast. So, what exactly is scabies? Scabies is a skin infestation caused by a tiny mite called Sarcoptes scabii. This mite is so small you can't even see it with the naked eye. It burrows into the top layer of your skin, lays eggs, and causes an allergic reaction. And that reaction is what makes you itch like crazy. It affects people of all ages, all backgrounds, and all skin types. It has nothing to do with being dirty. Anyone can get it. Scabies spreads through prolonged, direct skin-to-skin contact. We're talking things like holding hands, sharing a bed, or close physical contact with an infected person. It can also spread through sharing clothing, towels, or bedding, though this is less common. It spreads quickly in crowded places like schools, nursing homes, prisons, and households. So if one person in your home has it, there's a good chance others do too. Recognizing scabies starts with understanding its distinct signs and symptoms. So, what should you be looking for? The most classic symptom is an intense, persistent itch, known medically as pruritus. It often feels like it's coming from under your skin and dramatically worsens at night, which can severely disrupt sleep. This is because the mites become more active when your body is warm and at rest. Many people describe the sensation as unbearable and maddening. Along with the itch, you'll notice a pimple-like rash. If you look very closely, you might also spot thin, wavy, grayish-white or skin-colored lines. These are the actual burrow tracks left by the female mite as she tunnels to lay her eggs. In adults, these are most commonly found between the fingers, on the wrists, elbows, armpits, waistline, and genitals. In infants and young children, the rash can be more widespread, appearing on the head, face, neck, palms, and even the soles of their feet, areas not typically affected in adults. One important thing, symptoms don't show up immediately. If it's your first time getting scabies, your body needs time to develop an allergic reaction to the mites. It can take 4 to 8 weeks before you start itching. However, if you've had it before, your immune system recognizes the invader much faster, and symptoms can appear within just 1 to 4 days of exposure. Dealing with scabies can be incredibly frustrating, but the good news is that it's very treatable with the right approach. Effective prescribed medications can eliminate the infestation and provide relief. Let's walk through the standard treatment options. The number one treatment is a topical cream called permethrin 5%. You apply a thin layer to your entire body from the neck down, paying special attention to areas like between your fingers and toes, under your nails, and in skin folds. Leave it on overnight for 8 to 14 hours, then wash it off thoroughly. One application is often enough, but a second treatment 1 to 2 weeks later is usually recommended to kill any mites that may have hatched since the first application. For more severe or widespread cases, or when topical treatments fail, your doctor may prescribe oral ivermectin. This is a tablet that kills the mites from the inside out, typically taken as a single dose, followed by a second dose 1 to 2 weeks later. Now here's the most important part to avoid reinfestation. Everyone in your household and any close personal contacts must be treated at the exact same time, even if they show no symptoms. This is a common pitfall. If you treat yourself but not others, you'll just keep passing the mites back and forth, creating a frustrating cycle. It's also normal for itching to persist for several weeks after treatment as your body reacts to the dead mites. This doesn't mean the treatment failed. On the same day you treat yourself, you need to decontaminate your environment. Wash all clothing, bedding and towels in hot water, at least 60 degrees Celsius, and dry on high heat. For items you can't wash, seal them in a plastic bag for 72 hours. The mites can't survive without human skin for more than 2 to 3 days. Before we wrap up, there's one crucial point to remember. Even after successful treatment has eliminated all the mites, the itching can persist for another 2 to 4 weeks. This is completely normal and expected. It's not a sign of treatment failure. Your body is having an immune reaction to the dead mites and their debris still under your skin, and it simply takes time for this reaction to calm down. So, be patient. However, if you notice new burrows appearing, the rash spreading to new areas, or your symptoms significantly worsening after the initial treatment, it's essential to consult your doctor again for a follow-up evaluation. And that's our comprehensive guide to understanding and treating scabies. We've covered how to identify it, the steps for effective treatment, and the importance of decontaminating your environment. If this video provided clarity and helped you, please give it a thumbs up and subscribe for more simple, straightforward health content. Remember, this information is for educational purposes and isn't a substitute for professional medical advice. Leave any questions in the comments below. I'll do my best to help. Thanks for watching.